So in this video, I want to talk about some very interesting data on MS, multiple sclerosis. Okay, and it's based on Dr. Coimbra's protocol. Okay, so I put a link down below to learn a little bit more about this medical doctor, but it's quite fascinating, not just for MS, but for all autoimmune problems. What he found is if you use high doses of vitamin D3, you can see some serious improvements in autoimmune conditions. And as far as high doses, we're talking 1,000 IUs per kilogram. So I weigh 180 pounds. So I would be taking 81,000 IUs of D3. Now, the big concern for people is that, oh my gosh, I'm going to get too much calcium in my blood. It's called hyperkalcemia. And these are the symptoms: increased thirst, urination, stomach pain, constipation, nausea, confusion, depression, heart rhythm problems. But as I go through this, I'm going to explain how we solve that problem. Now, what's so unique about D3? Well, the first thing you need to know is that there's less incidence of MS in locations that have more sun, based on the latitude of where you live. Big clue right there. Also, if a pregnant female either takes vitamin D3 or is exposed to more sun before she delivers, that child has a less chance of developing things like asthma and different autoimmune conditions down the road. So vitamin D is an immune modulator. It actually controls and regulates the immune system. Every single immune cell has a receptor for vitamin D. Here's the problem. In our population, there's actually 4 different mutations or alterations in the vitamin D receptor. What does that mean? It means that a certain percent of the population cannot absorb vitamin D too well, in which case they would need to consume a lot more to create the same effect. And there's a lot of research going on in this area, but vitamin D influences over 3,000 genes. So it does a lot. So you can read more about the protocol, but one thing about vitamin D is when you increase vitamin D, you decrease the parathyroid hormone, okay? Because the parathyroid hormone kind of regulates calcium metabolism, and it has a feedback loop. When you're deficient in vitamin D, you have an increase of parathyroid hormone. And there also is some interesting connections between having a hyperparathyroid gland and developing or triggering autoimmune diseases, which is interesting. But what you would do is you take a blood test and you would measure your parathyroid hormone before you start the protocol. And then you would measure it after you start the protocol. If the parathyroid hormone doesn't decrease after you're starting to increase more vitamin D3, that means it's not working and you need to take more vitamin D3. Again, you can read some more about the details in this link down below. But you would also take DHA, which is a type of omega-3 fatty acid. You would also take zinc, and this is very, very important, vitamin K2. Vitamin K2 prevents the accumulation of calcium, and you'd want to take the MK7 version, 100 micrograms for every 10,000 IUs of vitamin D3. That would be the ratio that you would want to take, and that will keep your calcium in check, because you're also avoiding dairy during this process as well, and you're avoiding taking calcium. That way we can keep the calcium from being a problem, and we get the benefit from vitamin D3. Also take magnesium, which also helps the absorption of vitamin D3. Choline, B2, B12, folate, chromium, and selenium. The other thing that he recommended is to drink more water, like 2.5 liters. Because if there is any concentration of calcium, we don't want that turning into a kidney stone, so he recommended drinking more water. So I'm going to talk more about this vitamin D in future videos, but it's quite fascinating, and if you have MS, you definitely need to know about this protocol. Thanks for watching. So if you're enjoying this content, go ahead and share it with someone that could really benefit from it.